Hello everyone, so this is my ratings in analytic.ph thus far, and kakatapos lang namin ng MCN2, and my past rating was 58, so there's a increase. So I'm gonna correct myself sa mga mali ko para possible na tataas yung ratings natin. So this one, I actually had thought na kanya akong i-answer ang vast difference, but then again, I thought to myself na wala kayo ko ka-gets the running a question. So, pero in my heart, I would want to answer vast difference talaga for the, sorry, naman ko parang water ba, pero kaya na kaagin naman yung varicocele, but naka-forget na ko unsa ni siya. Naging na naman siya sa midterm, so unsa na lang ka ako na forgetfulness inig ka pagkatapos na ng third year, no? Wala na ko ka balik ko mga MCN topics, so dapat ako na ni siyang instill upon my heart karon summer. I-recall na to itong mga gitunan for the school year para di na ta mag-research kayo sa review season. So while explaining varicocele, so yung varicocele, the nurse identifies a key tubular component of spermatic cord. So abin dyan ako sa lalaki ni, pero nga ng prostatic urethra. Oo, kaya may prostatic, kanya babae, nag-iwo ko kayo ani. So sa din ang varicocele. The vast difference is a principal component of the spermatic cord along with the vessels and nerves. The ejaculatory duct and prostatic urethra lie within the pelvis, and the ureter is unrelated. So kailangan na to i-recall ang reproductive system ani nga topic. So defervescence period. What is defervescence period? The abatement of a fever, so si abatement die as indicated by decrease in bodily temperature. So nawala na. So kaning defervescence kaya mo ang pagkawala ba. Suspected dengue hemorrhagic fever, which early laboratory rising hematocrit. So I guess na suggest onset of plasma leakage. I guess na kung ano nila ko kanang eliminate sa choices. Sa choices, rising hematocrit with falling platelets indicates hemoconcentration from plasma leakage, a hallmark sign of severe dengue. So kailangan ka na po mag-review jud sa mga communicable diseases dengue part para sabot ko unsa jud ng dengue. So kani una ni sa midterms MCN. So move to a quiet room and arrange for urgent referral now when nagkuan siya psychosis. So achieve the listening adult most common results in which negative outcome isolation. So nag-like now, nagdili ako maka-inspire na. So which we leave a like jud. So especially sa mistakes na. A post-term newborn is delivered in a rural birthing facility through thick meconium. The infant is limp, not crying, with a heart rate of 70 and poor respiratory effort. So think ko nga it's too soon para mag endotracheal suctioning before providing any positive ventilation. But according to the newborn standards care, when naka abi na okay na ng heart rate na 70. Taas di kay nino kay 30 to 60 ang normal heart rate, or was it the respiratory rate? Hala ka, di man Lord, nag-research ko sa mga normal values sa pedia. Research ko ana. So naman tayo notes ana sa mga normal values, pwede niyo siya i-copy. According to the Philippine Newborn Care Standards, which action should the nurse perform first? Proceed to endotracheal suctioning before providing any positive ventilation. Okay. A non-vigorous newborn with thick meconium requires airway clearance before ventilation to provide pushing meconium deeper into the lungs to avoid. Okay. So kailangan i-suction siya daan para dili siya mo deeper kayo. Which maternal condition most increases the risk of preterm birth? Kuwalta na. Which interpretation best explains a preschooler who frequently asks why and initiates, okay, pretend play. Exploration, kanya ko po din gipnatakaan. Exploration reflects initiatives, building purposes. Who frequently asks why? So nag-ask siya binti why and initiates pretend play during barangay daycare observations in Manila. Exploration reflects initiative, building purpose. So frequently questioning and pretend play are classic signs of initiative in the preschool stage, leading to the virtues of purpose. So purposeful, no? Building purpose. So remember ang Eric Erikson nga mga virtue of purpose ang sa preschooler. Erikson describes this as a child's drive to try new roles and act on ideas. Okay, questions in create industry and promoting competence. Asa maning competence tapet. Kaya ang preschooler before pa siya nag-school, kay gusto siya purpose. Okay, a 2-day new old. So that's why gamay kay score atong MCN1 finals. Pero di balik ang kuan to paper. Just go. Lord help. So a 2-day old newborn in the district hospital in Quezon is lethargic, hypothermic, and feeding poorly, which diagnostic test best confirms the suspected bloodstream infection in this age group. Suspected bloodstream infection. Obtain blood culture as the gold standard diagnostic test. Blood culture is the gold standard for confirming neonatal sepsis. Complete blood count and C-reactive protein are supportive. Or your is not the primary. So kani po mo po niyan ta kung i-answer jud. So blood culture as the gold standard diagnostic for the blood culture dili CBC. Anong dili CBC? Because suggest infection through indicates but lacks specificity for definitive diagnosis. Okay. Last yeah. Dili niya is jud anti-urinary bladder for that's high fundos, continue basal insulin, frequent small oral sugar containing fluids, kung nado diabetes and poor appetite. Then you give small oral frequent reduce stimuli by dimming. So in a government maternity ward on postpartum day 2, looks exhausted, has perineal discomfort, and repeatedly describes her labor. She requests a full newborn bath. So encourage her to verbalize birth experience and schedule teaching tomorrow. Okay. Too demanding for a fatigue mother. If we provide step-by-step bath demonstration now, it's very demanding kasi exhausted nga siya. So i-allow pa nato siya para mag-encourage to verbalize sa iyang mga needs. Which mo pa nang answer pero I don't know, wala ko siya gitpick. 6-year-old postmenopausal client using ring pessary. So pessary is, I remember from my memory, is used when dili for kana bitaw na siya fistulas or varicocele ana bitaw. So vaginal dryness kay wala na siya estrogen hormones pa. Pelvic exam is otherwise stable, which action is indicated before intercourse. Teach removing pessary before intercourse. Mag-intercourse pa dili ay na 6 years old and using water-based lubricant liberally. So removing pessary before intercourse using lube, friction, okay. Reduces friction and discomfort. Internal rotation. A newborn screens positive for phenylketonuria at a provincial hospital. What immediate action aligns with the Department of Health newborn screening protocol? Promptly to a metabolic specialist. Nanuman. So for a positive screen, the newborn should be promptly referred for confirmatory testing and metabolic management. Okay. For newborn positive screen. A third trimester clients with gestational diabetes has fruity breath, deep rapid breathing, and decreased fetal movement. Fruity breath. Mama ni siya noon ay Ilani. What is the nurse's prayer direction? Initiate isotonic. Okay, so dito naman siya pas na. Initiate isotonic intravenous fluid and obtain capillary glucose ketone testing. Suggest ketoacidosis. Nakalimut na kung sa'yo naaning ketoacidosis, which is naaning siya sa midterm, I believe. Which compromises placental oxygenation and fetal status. Immediate fluid resuscitation with rapid assessment and laboratory testing is the priority. Diabetic ketoacidosis, nakalimutan ko na do. Adolescent counseling at the primary health station yung mga describes of line 1 ng therefore play particular before anything involved in love. Identify the imaging modality used to detect retained placental tissue, pelvic ultrasound, TI. CT scan, why is it not CT scan? Uses ionizing radiation, not preferred for intrauterine tissues, uses, okay. Pelvic ultrasound, first line modality to visualize retained products, okay, now I know. Which spirometry change? Spirometry best confirms reversible airflow obstruction in childhood asthma. Increase in forced expiratory volume in 1 second after bronchodilator use. Huh? Reversibility is demonstrated by a rise in forced expiratory volume in 1 second after a bronchodilator. This pattern supports asthma, which is characterized by variable airflow limitation. Other changes do not specifically confirm reversible obstruction. Spirometry, increase in forced reversible airflow. Say reversible is demonstrated by rise in forced expiratory volume in 1 second. Okay. Increase in forced expiratory in 1 second after bronchodilator use. So this is one of the basics, I believe, na funda ni siya dapat mabilong. So, a report to mong ay hydrocephalus na nag-increase. Stance and support. Arrange stance of the ultrasound with full bladder to localize the placenta. Ultrasound, dili mong i-use to localize the placenta. During a, vincristine infusion on a pediatric ward. Saan yung vincristine? Cytotoxic compound of alkaloid class obtained from the, a child reports burning to the peripheral area. Stop the infusion, keep the tachycardia and burning peripheral. Dili mo siya pa-slow, stop, dili mo siya. Is a vesicant. Kasi pasabot. Tending to cause blistering. Oh my gosh. The infusion should be stopped immediately. The cardiac kept possible for aspiration. Okay, I cannot picture that, pero okay, stop din akong infusion. Abdominal ultrasound is non-invasive. A post-cesarean mother, 12 hours after folio was removed, avoids frequent small amounts with suprapubic fullness. Intermittent catheterization using aseptic technique. So, third year, good luck, mag-catheter na pag-real na tao. Bladder scan shows 60 ml retained urine, which often is indicated. A significant post-void residual indicates acute urinary retention requiring immediate decompression. What? Intermittent catheterization using aseptic technique is indicated to prevent bladder overextension and infection. A nurse provides dietary counseling to a woman recovering from hyperemesis gravidarum on a public ward. In a public hospital with high patient turnover. Kasi, okay, the kind of patient to ano ratio siguro. Okay. After initiating isotonic bolus for dengue shock, which finding best indicates effective fluid resuscitation in an adult patient. Urine output increases with warm extremities and improved mental alertness. So, muna po na siya ay, kuhaan dito ako ng okay sa choices. Isotonic crystalloid bolus. In a public hospital with high patient turnover and planned perioneotomy is performed to reduce infection risk, which action is the priority for the nurse. Perform hand hygiene and don't use sterile gloves. So wala ko na done. Double glove after repair to dispose contaminated. Immediate hand hygiene and sterile gloves are the most critical steps to prevent infection. Ganyan ka isahan ko ang kaya double glove siya. Waste handling matters, but it's not the priority preventative step. Yeah, suicide jud. Immediate life threat. Wala may nakagyan ng Volvi. Object permanence is a object concepts at 10 months old is typically evident 9 to 10 months. Naming, body parts, and symbolic. Sabi na ng object permanence. Parang naarabit ang object bisag mawala. Wala kaning nakita. Something like that. Semen sample reached the DOH licensed laboratory 2 hours after collection at room temperature. Motility is low. What is the most appropriate explanation for these results? Delayed analysis and cooling reduced motility during transport. Delayed analysis and cooling reduced motility during transport. Okay, reduced motility during transport. A semen sample. Motility, okay. Also, nawala ang coolingness. So, delayed motility. Okay, apply warm forms of painful joints for sickle cell. Okay, bulging fontanelle. In a public hospital in Davao, a nurse prepares a client for ovarian reserve testing, in which menstrual cycle, they are follicle-stimulating hormone and luteinizing hormone typically drawn to assess ovarian reserve. I don't even know what is an ovarian reserve and why does that happen. So, day 3 on the cycle to assess ovarian reserve. So, in the 14th day, to confirm follicular rupture, mid-cycle time relates to ovulation, not reserve assessment. So, kailangan ako mag-review sa menstruation jud. For Hirschsprung, oh my gosh, which tama type is for routine descending colostomy. So, Hirschsprung manday ni nanatay glue na descending colostomy jud. Routine irrigation is preferred descending because stool is more formed in the descending. So, correct principle, but the question asks which tama is appropriate for irrigation. To foster independence. During a home visit in a coastal barangay in a child with spastic cerebral palsy. Okay, naka-spastic cerebral palsy. We know that Sister's Gate will receive a new chair. So, measure doorway widths and step heights and refer for ramps and widening assistance now. So, why did not I choose this? Oh my gosh. Murag, wala kayo nga panghitabo ka ng weird. So, i-measure ko din mo ang doorway kung maghatag ka o kung maghimo naman di ay mo o wheelchair. So, measure din mo doorway, guys. A woman with both fallopian tube, in vitro, so kaning mga types of which tubal pathology, in vitro fertilization with embryos created in laboratory and uterine transfer. So, kanina ni sa second namsian. which, ulit ko balon, saan siya pag-answer actually. And the first, nakalimutan ko saan siya ang mga gamit intrafallopian transfers. So for this, I feel like kailangan mo ma-memorize kung saan itong pag-fertilization process. So in vitro fertilization circumvents tubal disease by laboratory fertilization and uterine transfer, aligning with Philippine evidence-based practice for bilateral tubal occlusion. Circumvents tubal disease, okay. By lab na siya na-fertilize. So gamit na fallopian transfer, in vitro, legit siya. Ako di-answer kay tamid insemination. So, bypass tubal obstruction is ineffective with bilateral. So kaya na pa man siya sperm, so dapat naka-form na siya embryo. Correct ka dyan, girl. So, after initiating thermoregulation and fluid support for a newborn with suspected sepsis, which parameter best evaluates adequate perfusion to continue the current fluid states? Urine output adequate for wait over 2 hours without bladder distension, huh? Nakasabot sa question, nagsa-answer. After thermoregulation fluid support kasi newborn nga nag-suspect siya sepsis, saan mo pag-evaluate na nag-adequate perfusion siya to continue current fluid rate. Urine output ay adequate for wait over 2 hours without bladder distension. Systolic blood pressure, anong dili ang blood pressure yung nilantaw. Maintain pressure despite poor perfusion. Okay, I did not know that about neonates na maintain na sila blood pressure despite poor perfusion. Which antigen is present on red cells in type B blood? So, kanya ko kasabot sa antigen. Saan na siya pag type B, red cells express B antigen on the surface by the following blood banks. From forward groupings will show B antigen reactivity consistent with ABO principles under DOH standards. So, ano sa'yo pasabot ang antigen? Please, Anofi, review. Review your Anofi, girl. Okay, nag-loading pa ang atong wifi. Balikan na ko nila. Okay, moving on. Term female, meconium staining, anorectal malformation. So, funny thing is, a short conversation with my friends in school actually made this memorable for me because 48 hours dapat libang na dapat ang baby, or was it 24 hours? And if not, kaya na siya possible na Hirschsprung disease or kanang walay bangag ihang lubot, something like that. So, meconium staining at the vaginal introitus because anorectal malformation, rectal man sa rectum. So, I'm thinking na sulod siya ba sa iyang vaginal introitus. So, this talk na about na siya Bisaya. So, Wilms tumor, all I know about it is palpation, do not do it. But we must also keep the skin markings intact. I didn't know nga na siya skin markings, avoid friction, and yeah, protect from sunlight. I didn't know nga kailangan na siya buhaton sun. CS ang magka-thrombophlebitis, that's why ginabalik-balik dyan na siya itong exam sa OR. So, obtain culture specimen before administering the first ordered antibiotic dose. Super ego ang sa moral conscience. Masya false smelling milk, yeah. So, install safety gates at the top and bottom stairs. The nurse visits Riverside. Kerosene, so tama ka dyan. Your analysis shows 1+ protein dipstick. Okay, dili ko kayo sure ani, but karon confident na tanong nga proteinuria in a client with hypertension suggests preeclampsia rather than gestational hypertension. So, thankfully ato po ng report. So, pag 1+ pa siya nga 1 to 2+, it's mild preeclampsia, and we also have severe preeclampsia 3 to 4 na proteinuria. So, at a rural health unit with limited staff, secure infant, trusted caregiver, okay. Insomnia is also listed as a sign for the postpartum psychosis. So, grabe akong kuan dili ko correct. Insomnia. Swollen eyelids for 2 days is copious purulent discharge, eyelid edema, suggests gonococcal infections, mga STIs, tapos na tumibal, The first postoperative day, after nephrectomy, assess dressing and drain output, then notify the surgeon. So, in a level 2 newborn unit in Manila, what is the perimeter nursing action? So, ako lang gusto na ko i-state nga, during this test, kay I was bored out. So, kailangan dyan natin i-train nga ito ang focus nung nga dilita mo go sa other sites when we are in the zone of answering stuff because kanang mo zone out imong brain ba? Kailangan bring back dyan mo siya, ba? In a level 2 newborn unit in Manila, 32-week preterm on orogastric bolus feeding has 8 millimeters. Grain residual abdominal girth increased by 3 to 7 centimeters. Stop feeding. Keep stomach decompressed by lowering orogastric tube and notify the precision. So, what is the problem here, DI? Aspiration, I believe. Girth increase, I think. Green residuals with distension and lethargy such as possible enterocolitis. The nurse should stop feeding. Necrotizing enterocolitis, I don't remember na ako nang giagian, pero ako siya ibutang sa final sense. Pero stop din mo feeding sana, guys. Nag-increase diyang TNO. Stop na na. During discharge teaching, the mother asked about the chance that the future baby will have Tay-Sachs disease. So, kabalan sa Tay-Sachs. Which response should the nurse give? Each pregnancy has 25 chance risk of another affected child. Tay-Sachs is an autosomal recessive. So, kanang mga autosomal recessive, what's pasabot na? Giving a 25% chance of an affected child with each pregnancy when both parents are carriers. So, both parents are carriers for an autosomal recessive. What else are autosomal recessive? Ito lang i-discuss po sa finals, but, kalimutan ko na talaga yan. Tay-Sachs disease. We haven't discussed Tay-Sachs disease, should I? Presence with migratory polyarthritis, diagnosed acute rheumatoid fever. So, kasi na siya irrational, di ba? One major criterion plus two minor. One major, two minor meets the definition. So, two major, one minor po, somewhat. One major, two minor, man di ay. So, plate blood concentrate transfusion as prescribed for leukemia. Leukemia. Gum bleeding. Plate is indicated for thrombocytopenia with active bleeding. Thrombocytopenia. Which assessment finding most likely indicates neonatal polycythemia. So, dili siya mottling. Often presents as ruddy skin, lethargy. Pero sa kami ng mottling. So, cold stress niya siya, dili polycythemia. Sluggish capillary fill time and lethargy. Ruddy skin color. What does that even mean, ruddy skin color? How does that look like? Okay. Marag po siya mottling. More siya na, kuan, melasma. Okay. Polycythemia na siya. Client sensation should be anticipated and explained during probe movement. Balong sa probe movement ba? So, nang-zone off na siya akong brain, Pressure during movement. A pressure sensation during probe movement is suspected and should be explained. Severe pain or bleeding is not. Okay, what is probe movement? It's an ultrasound finding. Slide, rock, tilt, fan. Someone. This probe in pregnancy. The ultrasound scanner has probe that gives off sound waves. The probe looks a bit like a microphone. The sound waves bounce off organs in your body and the probe picks them up. The probe links to a computer and that turns sound waves into picture. Okay, sound waves into picture. So, this is a device pala. Pressure during movement. Ang talk about pressure during movement. Arrange to provide childcare informs medication adherence with follow-up. Risperidone is a sa drug for psychotics. So, for pregnant clients present at the RHU, which client needs priority referral based on risk for venous thromboembolism? Unilateral calf pain with swelling after long travel. So, mo ganyan akong story. Thromboembolism, no? After a long travel, so nag-stagnant ang person. Unilateral calf pain with swelling suggestivity. So, isa ra katiil ang nag-swell. Pregnancy, hypercoagulability, emergency requiring immediate referral for UH BMONC. Pwede ko kabalubihan sa ning BMONC. And CMONC. Man kaya nagikuan sa mo, basic emergency obstetric and neonatal care. CMONC is for comprehensive. So, BMONC is emergency obstetric and neonatal care. So, emergency siya, guys. So, okay na, malikuan niyo. Keep the leg rested, elevated, apply compress kung nakay hemarthrosis, which is, hemarthrosis is a indicator of what disease? Rheumatoid arthritis, which, no, hemophilia, which immediate instruction should the nurse give to implement initial foam management. A child with ankle hemarthrosis. Management includes cold application, gentle compression, and elevation to reduce swelling. Hemophilia, ang siguro, hemarthrosis. So, i-elevate na niya nato, no? Hindi na to siya exercise, dahil. Kaya ma-worsen ang bleeding, girl. Okay, my mistake. Public health nurse teaches adolescents about early cycle physiology, which hormone primarily stimulates growth and maturation of ovarian follicles. Estrogen, so una sige mo like estrogen, pero ano the purpose ng estrogen? Exerts variable feedback actions, modulates pituitary output, but does not directly drive follicle initiation. So, follicle stimulating kayo. Ganito din mo ovarian follicles. Which discharge instruction best supports perineal bone care protection after PSARP in a research-limited community setting. Apply zinc oxide after H2O. Perineal bone protection for PSARP. What's PSARP? With a zinc oxide after gentle cleaning helps prevent skin breakdown and contamination. What's PSARP? Weird lagi ito. Look at that. Posterior what? Posterior sagittal anterectoplasty. So, muna niya akong giingon nga wala siya bangag. So, most of the time there's anerectal malformation. Anal atresia. Anal atresia di ay ni. Wala siya bangag. Atresia kay wala bangag. Fistula kay na bangag. From bottom of the child. For this purpose, we make incision in the midline. Oh, wow. Before. After. Most of the time, straight from bottom for this specific. Ang siya di pasabot sa atresia, guys. Ito sa atresia mo. Mama! Shush. A congenital condition present where a natural body opening or tubular is abdomic o tama lagi. Atresia is a closed Pero yan yun. Absence of both external ear and wala siya ear. So, makadibog ba ni? Before discharge from a government hospital, first time mother expresses anxiety about introducing odors. So, first never introduction to the system. So, we address the question today. So, huwag ka nang imo bitang kunahon kay address nimo ang question. Dili na ka kuan bitaw liko sa other nga topics. Okay. Okay. So, ako kabaluan pero correct siya. Mag-IOD ka. Against IOD ka. Favorable for avoid during surveillance to bleeding and perforation. So, avoid kag IOD if nagka-bleeding na kadira. Sperm, of course. Reagent warmer. New hostelic more. Suggest vulvar involvement from carditis. 15 grams fast acting carditis. Says every 15 minutes. Type 1 diabetes. Reproductive loss, of course. So, okay, dagan kay correct no? 13-year-old couple's friends. Okay, ang exam conformity indicates role confusion. Juday ni siya. Abi na ko, kanina mo siya kay murag nice kay siya pagka-English. Babi na ko muna siya answer. So, really, I know. Unexamined conformity indicates role confusion but lacking stable self-definition. Role confusion arises when adults fail to explore and integrate roles within adults and... Okay. So, Erickson defines infancy as birth to 18 months. Okay. Infancy is birth to 18 months para kay Erickson DI. Okay. Shortens the expected Ericksonian infancy span. So, wait, weird lagi kay Erickson kay mo 18 months. Kasi nasa 18 months. That's 1 year and minus 7. So, half, kundi siya. 1 year and a half. Almost. Perform, IgM activates complement. So, IgM, IgE, ananap to. Naturally occurring predominantly IgM can activate complement immediately. Intravascular red cell lysis. So, wala ko sabot ato pero ang kailangan ito malaman dyan sa purpose ng mga IgM, IgE, ano. Third, combined oral pills with sudden chest pains and breathlessness. On combined oral pills. Collect vaginal swab for nucleic acid amplification by polymerase chain reaction on sa naman yung swab. Okay, so, really, mag-trichomonas. Strawberry service suggests trichomonas, yes. Best confirmed by nucleic amplification using polymerase chain reaction due to higher sensitivity. Okay, so, yes, trichomonas ang strawberry cervix, but dili mo siya ay vaginal culture. Collect vaginal swab for amplification, kana siyang answer. So, kasabot amplification dahil use appropriate coverage check manually notify for anti-hypertensive disorder. So, imagine no, 100 items na naka 92% ka. So, 92 mo score. Grabe niya. Dili mo na 40 psychic apparatus. Term for it, igo. Psychic apparatus, di ay. Arrange bedside peer modeling with similar mother. Then coach return demonstration now. So, kani repeat negative urinary protein. Gestational hypertension. Blood pressure 140/90. Twice 6 hours. Okay, ha? Ano? Abi na ko. Hypertension last 20 weeks with blood pressure 140/90. Hypertension na siya. 120/80 normal. So, below diagnostic threshold. Okay, so abi na ko 140/90 ang kuan ka ng. Kuan na ba siya na? Na siya gestational hypertension. Di aya 140. Abi na ko na siya pre-eclampsia na basta 140/90. That's weird. So, ano sa juday ay ang pre-eclampsia, no? Sa juday ang pre-eclampsia, gestational hypertension. Okay, 140/90 that develops 20th week of pregnancy in a woman. So, when can we say it's kuan ka ng pre-eclampsia? Greater than or equal to 140/90 gihapon. Gun damage, but it's greater than. Yeah, so same rin gihapon na 140/90. Ano na range. Okay, naka-remember na ko, tama ka. Oral intake meets estimated needs and urine ketones remain persistently negative. Ketones, nakalimot na po sa pathophysiology ng ketones tayo. So, diagnostic pressure at 68 and lightheadedness on standing today. A client treated antihypertensive for pregnancy hypertension is being monitored in the ward, responding requires immediate nursing after to prevent uteroplacental underperfusion. New sleep disturbance with increasing irritability. Wala ko kasabutan ni do. Systolic pressure at 68 with lightheadedness on standing today. Okay, kung nakay ko daw midterms ni. Client with antihypertensive therapy for
pregnancy hypertension is being monitored. Okay, so immediate nursing action to prevent uteroplacental underperfusion. 68 to lightheaded nurse. Okay, muna na siyang i-report. Kung na siya facial flushing, vasodilator effect naman good na. Okay, pag mo pang dilate man good, so flushing is a effect na siya. Use upright force soaps pneumonia. Manitaw ma. Kupransing na. A pregnant 28-year-old with oral fresh and persistent generalized lymphadenopathy seeks prenatal care. To apply assessment and planning following Philippine Department of Organization or Rhythms. Which screening step should the nurse prioritize with consent? First-generation antibody with monsoon. Asi, wala, ko kasabot ay girl. Lymphadenopathy. Ano sa ganun lymphadenopathy na sakit? To apply assessment and planning following Philippine screening step should be used when set post-linkage. Fourth-generation Tijan with monoassay. Okay, hindi ko naman sir. Monoassay, sama na yun. Hindi ko kasabotahan na mabilong. The shot test in fourth-generation is virus, antigen, antibody, immunoassays with counseling and linkage of care. Wala sa mga sakit guys. Lymphadenopathy, pwede ko ikuan. Ako nang screenshot. Hindi ko na makuan bro. Activate security protocol and notify psychiatry immediately. Potential infant harm and force unit security. Okay, that's all.